know कौन है, but Dr.
Yes.
Hubert और Dennis दोनों हैं.
Thank you, Dr. Deepamala and Shahani sir. Good evening, good afternoon, and good morning. This is the 1327th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. A. SIVASHANKAR. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know that International Forum for Promoting Homeopathy is conducting 3 sessions in a row on daily basis. And from 7 to 8 p.m. we have our Hindi session, and 8 to 9 we have our international session in English, and 9 to 10 a local language session in Malayalam. So all these days we have presentation from different doctors and homeopathic lovers from different part of the world. And today we got a wonderful guest in Dr. A. SIVASHANKARAN, who has completed his MD in homeopathy and is working as an assistant professor, Department of MEDICA, MEDICA, BBHMC, Bangalore. And he has 12 years of clinical experience, and he has presented some presented papers in the last editions of our webinars. And today he will be presenting a subject, the importance of as you all know that as a homeopath, you have to observe the patient before prescribing. Whether whatever may be the illness, it doesn't matter much. What matters is what he is showing in the clinic, or what what you are seeing in the bedside. So let us see. He is a person who uses the organon of as well as METERIA, MEDICA, and REPERTORY to find out the correct SIMILIMUM. That is that we used to say that the classical method of homeopathy, and of course there are different methods also. This is what I have to tell about this today's presentation, and he will be demonstrating with some cases also. Dr. Hubert will be sharing from the other end the cases for him. So let us welcome Dr. SIVASHANKARAN in this forum. Okay. Yes, doctor, you can begin the session. Please unmute yourself. You are co-host.
Sir, good evening, sir. Good evening, respected senior doctors, teachers, and my dear friends. Today I'm going to present the cases, cute cases, how observation helped us to arrive at the right limit. Because when I was beginner, when I opened my clinic, I was very much busy in rating the point. I had a fear that I may miss, because homeopathic case taking is detailed case taking. I may miss the points. I was in my beginning days of practice, I was writing all the points, but I was missing the observation. Since few years, whenever I see the patient, first I keep my cases aside. First I will speak to the patient. What is your complaint? I maintain eye-to-eye contact. I will speak to them properly. What is your complaint? First I try to understand. Then I try to keep the points in my temporary memory for 5 minutes. Then I write down the complaints. So whenever I started doing more observation, success rate were more. Earlier I was taking case for 1 hour, 1.5 hours. So much data. Still I was giving partial remedy. Once I started observing well, of course, I was motivated by many stalwarts, senior teachers. Once I started observing the patients well, I was able to solve many cases just in 20 to 25 minutes of case taking. So what I felt, we need to be, and even Hanamana told very clearly, the observation is very, very important. Dr. Kent says, the will of the patient is expressed in the countenance of the patient. The deviation in the will and emotion, the intellect, memory is very important. Mainly the deviation in the will and emotion. The will is expressed in the countenance of the patient. That means if we observe the patient's face very well, the face will tell many things. Whether they're anxious, whether they're egoistic, whether they're haughty, the way they come, the way they sit. So we need to be good observer. So I would like to present one case. I would like to request Dr. Hubert to share the case. Dr. Hubert. I want MS Word, say MS Word. This is a patient who is around, no, next, first one, please go above. Yes, new case. No. So it's a case of diabetes mellitus. Patient is having FBS 124, PP 247, PP 241. HbA1c was 7. Can you open the MS Word, sir? MS Word.
Doctor, just before that, there is a file that.
Yes.
you-
Ramana Gowda.
yes, that one.
Yes.
Just please download and then. Yes. Exactly.
Yes. See, the patient is suffering from. I could see this patient through online. One of the patients who got cured had given my number, my reference. The aim of the presentation to demonstrate the importance of observation skills in our clinical practice, even to the follow-up criteria, which is mentioned in aphorism 253. Patient is 43-year-old. He's a science high school teacher. His main complaints are gastric complaints. What made me to come to me? When I saw the patient, when he came for the video call, that he said, "Sir, namaste, sir. Sir, I have enlisted the complaints. I have made the list of the complaints. So shall I tell one by one?" I said, "Please go ahead." He took my permission. Then he said, "Sir, I have gastric complaint, anxiety, sleeplessness, diabetes, hypertension, anger tendency." The case was written in the flow of the patient, not according to the format. I believe in much in the flow of the patient rather than the format. Later, I asked, "You said gastric complaints. What is this? Can you elaborate?" He said, "So since my high school days, to study, I studied 10th standard, my PUC, all my BA, BEd, BSc, BEd, everything in the hostel. So I was eating the hostel food, outside food. I developed gradually bloating of abdomen and passing flatus. So now also it is a problem, causing problem to him. Whenever eat early, eat late, eat more, eat spices, cereals. When stools are not clear, he develops bloating of abdomen. He passes flatus. Stools smell a lot." He also tells, so whenever I go to pass stools, I have to go for nearly 15 to 20 minutes. Sir, if I go after 8 o'clock, 15 to 20 minutes I have to pass the stool. If I go before 7:30, early morning, twice or thrice I have to go. And whenever he pass urine, he pass stools. Simultaneously, he also pass urine 3 to 4 times. In this 15 to 20 minutes of passing stools, he also passes 3 to 4 times urination. The concomitants were, he becomes very irritable and he feels trembling in the head, light-headed feeling, stools not clear. Whenever he go to the new place, a colleague's house or any relative's house, whenever he go to the new place, he has gone to the relative's house. If he has to go for toilet, stools are not clear. When guests come to the house, they are staying in the house. He has to go to the toilet room to pass the stool. Stools are not clear. When somebody walking outside the toilet room, if somebody is walking outside the toilet room, inside the toilet, he will not be able to pass stools properly. His second complaint was anxiety. He says, whenever I met new people, I get anxiety. Talking on new subjects, he gets anxiety. Talking and with new circumstances. When he is in high school, he says, "For me, my school is very comfortable place. I'm quite confident when teaching to my students. My confident while speaking to my colleagues. Whenever I have to go to some other office, government office, any bank, or whenever I get new circumstance, I get anxiety. And whenever he is riding the bike, whenever he sees the dogs, he gets fear. Dog may come and bite me. So he will be too far from the dog by seeing the dog. Anger tendency. So whenever he hears the sound, when children are screaming, his own children or even in the classroom, children are screaming, making noise, he gets angry. Whenever somebody tells repeatedly same thing again and again, he gets angry. And whenever he see outside, things are not in proper place, imperfectness, things are episode, he gets angry. Sleep is not enough. Wakes up early when he has, whenever he has some task tomorrow morning he has tasks, he has to do some performance. So morning he keeps the alarm at 6 o'clock. But because of anxiety, night he'll be waking up around 2:30, 3:30, he'll be seeing the alarm, is 6 o'clock happened or not. Tomorrow if he has some seminar to present, tomorrow he has some activities to be done in the school or outside. He becomes anxious. He frequently wakes up and sees the alarm. Is it 6 o'clock? It's 6 o'clock. This is the scenario. He wakes up at 1:30, 2:30, 3:30. So sleep is not deep. He also said in 2017, he was admitted for typhoid. That time he also had giddiness. He was prescribed allopathic medicines. He was also prescribed Timetil injection. Since then, he got recovered from giddiness, from typhoid. He developed pseudo Parkinson's disease. The neck was stiff nearly for 2 to 3 months. So gradually it declined, it disappeared. Then afterwards, what happened? So after a few months, he developed some tiredness. Went to the doctor, local doctor. On blood investigation, GRBs was 245. After the doctor said, let us wait and watch. You might have some stress. Let us wait and watch. Then after a few months, he checked the sugar level. FBS was 97. CTBS was something 180. Like that, it was fluctuating. Doctor told, you are a pre-diabetic, you are a pre-hypertensive patient. Doctor gave the option, shall we treat or we shall wait and watch? He preferred to wait and watch. So can you play the video, sir? The first video. The video is in our WhatsApp, sir. Please come back, sir. Yes, sir. Please come down. Yes, sir. Please, sir. Can you make it big, sir? You will be able to play the sound, sir. Okay, fine, sir. So I will share the screen from my mobile, sir. The video. I request all doctors to be patient for under 1 minute. Just I will show the video of the case. Patient is telling, sir, I have made the points of the complaints, one after the other. Shall I tell the complaints, sir? I said, please go ahead. He's telling his main complaint is gastric and anxiety.
No sound is coming, doctor. The audio is not coming.
The sound is not coming, sir.
Here I can hear.
Oh, yes.
The patient sound is not coming, sir.
I can hear.
You can hear, sir. Okay, fine. Okay.
Hold on. Share sound. Okay. Okay.
ಜೊತೆಯಲ್ಲಿ ಯಾರು ಇದ್ದಾಗ ಸರ್
Now?
ಜೊತೆಯಲ್ಲಿ ಎಲ್ಲಾದ್ರೂ ಹೊರಗಡೆ ಹೋದಾಗ ಸ್ವಲ್ಪ ಮುಜುಗರ ಅನಿಸುತ್ತೆ ನಂಗೆ ಹೋಗೋಕೆ.
Can you hear now?
Yes, sir. Yes, sir.
ಸರ್ ಆಂಗ್ಸೈಟಿ ಬಗ್ಗೆ ಮಾತನಾಡ್ತೀನಿ ಸರ್. ಹೊಸ ಸನ್ನಿವೇಶ ಅಥವಾ ಹೊಸ ಜನ ಇದ್ರೆ, ಹೊಸ ವಿಷಯ ಇದ್ರೆ ಸ್ವಲ್ಪ ಭಯ ಅನ್ಸುತ್ತೆ. ಎಲ್ಲಕ್ಕೂ ಸ್ವಲ್ಪ ಭಯನೇ ಅನಿಸ್ತದೆ ಸರ್. ನಂದು ಹಳೆ ಜನ ಹಳೆ ಇದ್ರೆ ಮತ್ತೆ ನಾನು ಟೀಚರ್ ಆಗಿರೋದ್ರಿಂದ ನನ್ನ ಸ್ಟೂಡೆಂಟ್ಸ್ ಜೊತೆಗೆ ಕಲೀಗ್ಸ್ ಜೊತೆಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿರ್ತೀನಿ. ಬೇರೆ ಕಡೆ ಬೇರೆ ಸನ್ನಿವೇಶ ಅಂತ ಹೇಳಿದ್ರೆ ನಂಗೆ ಸ್ವಲ್ಪ ಭಯ ಮತ್ತೆ ಇನ್ಫೀರಿಯಾರಿಟಿ ಕಾಂಪ್ಲೆಕ್ಸ್ ಇದೆ ಸರ್.
Yes. Can you pause, sir?
ಒಂದು ನಾಯಿ ಇದ್ರು ಕೂಡ ಅದು ನಂಗೇನ್ ಮಾಡ್ಬಿಡ್ತದೋ ಅಂತ ಭಯ. ಅಷ್ಟು ದೂರ ಇದ್ರು ಕೂಡ ನಾನು ಭಯ ಪಟ್ಕೊಳ್ತೀನಿ. ಈವನ್ ಬೈಕ್ ರೈಡಿಂಗ್ ಮಾಡುವಾಗ ಕೂಡ. ಇದು ಆಂಗ್ಸೈಟಿ ಬಗ್ಗೆ ಸರ್. ಇದು
Sir, can you
ಹೊಸ
clear the
ಸನ್ನಿವೇಶ, ಹೊಸ ಜನ, ಹೊಸ ವಿಷಯ.
I want our doctors to observe, sir. Though the patient is speaking in Kannada, because our primitive language is sign language. From the beginning, sir. Yes.
ಸರ್ ನಾನು ಕ್ಯಾಟಗರೈಸ್ ಮಾಡಿದ್ದೀನಿ. ಮೊದಲನೇದು ನನಗೆ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಸಮಸ್ಯೆ ಸರ್. ಇನ್ನೊಂದು ಆಂಗ್ಸೈಟಿ, ಆಮೇಲೆ ನಿದ್ರೆ ಬಾರದೇ ಇರೋದು, ಶುಗರ್ ಅಂಡ್ BP.
Patient is telling, narrating one by one.
ತುಂಬಾ ಕೋಪ ಬರೋದು. ಸರ್ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಅಂದ್ರೆ ನನಗೆ ಬೇಗ ಊಟ ಮಾಡಿದ್ರೆ, ತಡವಾಗಿ ಮಾಡಿದ್ರೆ, ಸ್ವಲ್ಪ ಹೆಚ್ಚು ತಿಂದ್ರೆ, ಅಥವಾ ಮೋಷನ್ ಕ್ಲಿಯರ್ ಆಗದೆ ಇದ್ದಾಗ, ಬೇಳೆ ಮತ್ತು ಖಾರದ ಈ ತರ ತಿಂದಾಗ, ಮತ್ತೆ ಮೋಷನ್ ಸರಿಯಾಗಿ ಆಗದೆ ಇದ್ದಾಗ, ಹೊಟ್ಟೆ ಉಬ್ರ ಅನ್ಸುತ್ತೆ, ಆಮೇಲೆ ಗ್ಯಾಸ್ ಪಾಸ್ ಆಗ್ತದೆ, ಮೋಷನ್ ಆಗಲ್ಲ.
Yes, pause, sir. He's telling gastric means
ಸ್ಮೆಲ್ ಇರ್ತದೆ ಸರ್. ಅದು ನಂಗೆ ತುಂಬಾ ಕಿರಿಕಿರಿ ಉಂಟು
less
ಮಾಡುತ್ತೆ.
food.
ಮತ್ತೆ
Whenever he eats excessive food, less food,
ಹೌದು ಸರ್, ಹೌದು ಸರ್, ಹೌದು.
he gets bloating. He's narrating. So I have not told him to give the case like this. He himself had written all these complaints. Step by step, he's telling. Yes, sir. Play, sir.
Shall I close it? Or
Play,
continue?
play, sir. Play. Continue.
ಆಮೇಲೆ ಶೌಚಕ್ಕೆ ಬೇಗ ಅಂದ್ರೆ 7 to 8 o'clock ಇಷ್ಟೊಳಗೆ ಹೋದ್ರೆ, ಮತ್ತೆ ತುಂಬಾ ಹೊತ್ತು ಸರ್, ಒಂದು 15 to 20 minutes ಹೋದ್ರೆ ನನ್ಗೆ ಕ್ಲಿಯರ್ ಅನಿಸ್ತದೆ. ಬೇಗ ಬಂದ್ರೆ ಅಥವಾ ಅದಕ್ಕಿಂತ ಮುಂಚೆ 7 o'clock ಇಂತ ಬಿಫೋರ್ ಹೋದ್ರೆ ಕ್ಲಿಯರ್ ಅನ್ಸಲ್ಲ. ಮತ್ತೆ ಆ ಸಮಯಕ್ಕೆ ಮತ್ತೊಂದ್ಸಲ ಹೋಗ್ಬೇಕು ಅನ್ಸ್ತದೆ ಸರ್. ಮತ್ತೆ ಶೌಚಕ್ಕೆ ಹೋದಾಗೆ ಮೂತ್ರ ಒಂದು 3-4 times ಸ್ವಲ್ಪ ಮೂತ್ರ ಹೋಗ್ತದೆ. ಆಮೇಲೆ ಈ ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಇದ್ದಾಗ ಸರ್ ಸಂಕಟ ಆಗುತ್ತೆ, ಒಂಥರ ಅಸಹನೆ, ಆಮೇಲೆ ತಲೆನಲ್ಲಿ ಏನೋ ತೊಂದರೆ ಇದೆ ಅಂತ ಅನಿಸ್ತದೆ, ಒಂಥರ ನಡುಕ, ತಲೆಯಲ್ಲಿ ಒಳಗ್ ನಡುಕ ಆಗುತ್ತೆ ಏನೋ ಅನಿಸ್ತದೆ ಸರ್. ಕೆಲವೊಮ್ಮೆ ತುಂಬಾ ರೇರ್ಲಿ ತಲೆ ಹಗುರ ಅನಿಸ್ತದೆ, ಲೈಟ್ ವೇಟ್ ಅನಿಸ್ತದೆ.
He's telling during gastric, I feel
ಆಮೇಲೆ
irritable.
ಬೇರೆ ಸ್ಥಳ, ಊರು.
During gastric, I feel irritable. Okay. Lightheadedness. My head feels very light. All these complaints he's telling.
ಮತ್ ಮನೆಯಲ್ಲಿ ಯಾರಾದ್ರೂ ಹೊಸಬ್ರು ಬಂದಿದ್ರೆ ಶೌಚ ಕ್ಲಿಯರ್ ಆಗಲ್ಲ ಸರ್, ಮುಜುಗರ ಆಗುತ್ತೆ. ನಿಯರ್ ಬೈ ಟಾಯ್ಲೆಟ್ ರೂಮ್ ಯಾರು ಓಡಾಡಿದ್ರು ಕೂಡ ನಂಗೆ
I'm not able to pass tools properly. New people or whenever I go
ಶೌಚ ಕ್ಲಿಯರ್ ಆಗಲ್ಲ.
other colleagues' house or any relatives' house.
ಹೌದು ಸರ್, ಹೌದು, ಕ್ಲಿಯರ್ ಆಗಲ್ಲ ಸರ್, ಕ್ಲಿಯರ್ ಅನ್ಸಲ್ಲ ಸರ್. ಇಲ್ಲ ಸರ್, ಇಲ್ಲ. ಜೊತೆಯಲ್ಲಿ ಯಾರು ಇದ್ದಾಗ ಸರ್,
Whenever he goes to even
ಎಲ್ಲಾದ್ರೂ ಹೊರಗಡೆ
urination, public toilet, that time also he feels discomfort.
ಹೋದಾಗ ಸ್ವಲ್ಪ ಮುಜುಗರ ಅನಿಸುತ್ತೆ ನಂಗೆ ಹೋಗಕ್ಕೆ. ಇದು ಗ್ಯಾಸ್ಟ್ರಿಕ್ ಸರ್. ಆಂಗ್ಸೈಟಿ ಬಗ್ಗೆ ಮಾತನಾಡ್ತೀನಿ ಸರ್. ಹೊಸ ಸನ್ನಿವೇಶ ಅಥವಾ ಹೊಸ ಜನ ಇದ್ರೆ, ಹೊಸ ವಿಷಯ ಇದ್ರೆ ಸ್ವಲ್ಪ ಭಯ ಅನ್ಸುತ್ತೆ. ಎಲ್ಲಕ್ಕೂ ಸ್ವಲ್ಪ ಭಯನೇ ಅನಿಸ್ತದೆ ಸರ್. ನಂದು ಹಳೆ ಜನ ಹಳೆ ಇದ್ರೆ ಮತ್ತೆ ನಾನು ಟೀಚರ್ ಆಗಿರೋದ್ರಿಂದ ನನ್ನ ಸ್ಟೂಡೆಂಟ್ಸ್ ಜೊತೆಗೆ ಕಲೀಗ್ಸ್ ಜೊತೆಗೆ ತುಂಬಾ ಚೆನ್ನಾಗಿರ್ತೀನಿ. ಬೇರೆ ಕಡೆ ಬೇರೆ ಸನ್ನಿವೇಶ ಅಂತ ಹೇಳಿದ್ರೆ ನಂಗೆ ಸ್ವಲ್ಪ ಭಯ ಮತ್ತೆ ಇನ್ಫೀರಿಯಾರಿಟಿ ಕಾಂಪ್ಲೆಕ್ಸ್ ಇದೆ ಸರ್.
Yes, he's having multiple fears. Fear with new place, fear to talk about unknown subject by seeing the dogs that he's elaborating. Please.
ಒಂದು ನಾಯಿ ಇದ್ರು ಕೂಡ ಅದು ನಂಗೇನ್ ಮಾಡ್ಬಿಡ್ತದೋ ಅಂತ ಭಯ. ಅಷ್ಟು ದೂರ ಇದ್ರು ಕೂಡ ನಾನು ಭಯ ಪಟ್ಕೊಳ್ತೀನಿ. ಈವನ್ ಬೈಕ್ ರೈಡಿಂಗ್ ಮಾಡುವಾಗ ಕೂಡ. ಇದು ಆಂಗ್ಸೈಟಿ ಬಗ್ಗೆ ಸರ್. ಇದು ಹೊಸ ಸನ್ನಿವೇಶ, ಹೊಸ ಜನ, ಹೊಸ ವಿಷಯ, ಹಳೆ ಜನದ ಜೊತೆಗೆ ಹೊಸ ವಿಷಯ ಮಾತಾಡ್ಬೇಕು. ಈವನ್ ನನ್ಗೆ ಗೊತ್ತಿದ್ರು ಕೂಡ ನನ್ ಸ್ವಲ್ಪ ಆಂಗ್ಸೈಟಿ ಅನಿಸ್ತದೆ ಸರ್. ಮತ್ತೆ ಸಿಟ್ಟಿನ ಬಗ್ಗೆ ಮಾತಾಡೋದಾದ್ರೆ ಜಾಸ್ತಿ ಸೌಂಡ್ ಆಗಲ್ಲ ಸರ್. ಯಾರಾದ್ರೂ ಕಿರ್ಚ್ಕೊಂಡ್ರೆ ಆಗಲ್ಲ, ಮತ್ತೆ ಗಲಾಟೆ ಮಾಡಿದ್ರೆ ಆಗಲ್ಲ, ಪದೇ ಪದೇ ಒಂದೇ ವಿಚಾರದ ಬಗ್ಗೆ ಯಾರಾದ್ರೂ ಮಾತಾಡಿದ್ರೆ ಆಗಲ್ಲ, ಮತ್ತೇನಾದ್ರೂ ಒಂದು ಇಂಪರ್ಫೆಕ್ಟ್ ಕಾಣ್ತಾ ಇದೆ ನನಗಂದ್ರೆ ಅದನ್ನಾಗಲ್ಲ. ಇದು ನಂಗೆ ಸಿಟ್ಟು ಉಂಟು ಮಾಡೋ ಇದು.
Yes, sir. Please come back to the MS the case, sir. I would like to ask our doctors, could you do any observation in this video? The observations were, okay, he wishes the doctor, seeks permission to enumerate his complaints. He was sitting straight with bending forward, and you might have observed many times he was seeing me very clearly. He was seeing like this. He was very observant. And he has written all the points in a very, very well orderly manner, very systematic, one after the other, one after the other. And he is detailing complaints one after the other in a vivid way, very particular about his complaints. There was a prominent mole on the right side of the cheek. And every time he speaks to me, he uses the word sir, sir. He uses the word sir many times when telling his complaints. He was nodding up the head while answering. These were my observations. The family history. Father died at the age of 70 years because of he had diabetes and heart complaints. Mother is apparently healthy, hypertension and diabetes. How was his childhood? Because he's telling he's having gastric complaints, he's having anxiety. Okay, his sleep is not good. So I wanted to know about his childhood. He said, sir, till my 7th standard, my father was a primary school teacher. We have 3 children. I have one younger brother, one younger sister. Till 7th standard, I was in my village. I was studying. That time, my confidence was good. Though we had 3-4 pairs of clothes, still I was confident in the village. Then to study my 8th standard, I had to go to my relative's house, to a taluk area, from village. There, I was staying in my relative's house. There, I was feeling hesitation. If I want to eat anything, if I want something, I was not able to ask. Since I cannot demand from relatives, I can demand from the parents. So gradually, when he went to study 8th standard, 9th standard in the relative house, gradually his confidence became less. Gradually, he developed hesitation in his life. Then what happened? 10th standard onwards, he went to the hostel, where the hostel food was not that much good, and he was eating outside. He developed bloating of abdomen, passing flatus a lot, smelling gas. All these complaints developed. It became part and parcel of his life. Now in a week, he takes 3 to 4 times pantoprazole. Almost he takes alternate day pantoprazole for his gastric complaints. Next, yes. In childhood, can you come above a little bit? Yes. So I asked, in your home, who was very fearful? He said, my mother is very fearful. Father was strong and strict. So here, after the complaints, immediately went for, after family history, immediately went for life-based investigation. Because since the patient was interested to tell about his life-based investigation, rather than the personal history. In school, he is very comfortable. He's a very good teacher, teaches quite confidently. Memory weakness. Whenever he sees many people, he might have seen the people 4 or 5 years back. Whenever those people come in front of him and speak to him, he will not be able to recognize those persons. They have to tell, sir, I had seen you a few years back. Then he will realize, oh, I had seen that person 2 years back. When compared to his brother, he does not mingle with others easily. He is very timid. Personal history, he likes sweets. But since diabetes, he is avoiding the sweets. Sleep is 11 p.m. to 6 a.m., not feeling refreshed. Wakes up at night, 2:30 a.m. to 3 a.m. Thermals is towards chilly. He can tolerate heat better. He cannot tolerate cold. Fanning not required. Covering not required. Recently, he developed an ejaculation problem. Since he did not tell in the first beginning, he told now he's telling he's getting ejaculation problem. Again, since childhood, he had a gum problem. There was bleeding from the gums, swelling of the gums, like gingivitis. and teeth are loose since his high school days. So this was the scenario. Then later he asked, after the consultation over, he asked, sir, I have heard that homeopathic medicine do not have side effects. So is it so, sir? Then I said, yes. We take case in detail. We give very less quantity of medicine. We give medicine to stimulate the body mechanism. So medicines have less side effects, or literally no side effects, or very negligible side effects. Then he asked, so after you give medicine, since I'm in my native place, you give medicine. Meanwhile, if I develop any cough, cold, any fever, any complaints, what shall I do? Shall I take allopathic medicine here? I told him, you have to inform me over the phone. I will adjust the regular medicine, what you are taking. In case if you require, then and only I will tell to take the medicine from nearby doctor. Then he said, so till now in my life, I have not spoken openly to any doctor. For the first time, I am speaking all my complaints, sir. Whenever I had been to allopathic doctor, they were speaking to me only for 3-4 minutes, and they were giving medicines. For the first time, I have opened up all my complaints very openly. I'm sure, sir, I hope, sir, I may get a very good result from your treatment. He trying to praise me a little bit. And so we gave a medicine. The follow-up after a month, he gave the follow-up that he is feeling better. He said, in this 15 days, so I have in this month, so I have taken only gastric medicine only once. Earlier, I was taking 3 to 4 times in a week. After taking medicine, for the first week, there was a little bit aggravation of the gastric complaints. I told him to take antacid one time. Then afterwards, in the second week onwards, his gastric level came down, sleep became better. He's frequently waking up in the night, reduced. His energy level was better. When I observed, his face was glowing, was smiling. Just I would like to show you the videos, sir. Follow-up videos. Yes.
ಸರ್ 15 days ಬಿಟ್ಟು ರಿವ್ಯೂ ಮಾಡೋಣ ಕಾಲ್ ಮಾಡ್ರಿ ಅಂತ ಹೇಳಿದ್ರಿ ಸರ್. ಸರ್ ಚೆನ್ನಾಗಿ ಅನಿಸಿದೆ. ಮೊದಲನೇ ವಾರ ನನಗೆ ಸಿವಿಯರ್ ಅಸಿಡಿಟಿ ಅನಿಸ್ತು, ನಿಮ್ಗೆ ಕಾಲ್ ಮಾಡಿದ್ದೆ. ಒಂದು ಮಾತ್ರೆ ತಗೊಳಕ್ ಹೇಳಿದ್ರಿ ಸರ್, ತಗೊಂಡೆ, ಸರಿ ಹೋಗಿದೆ. ಕೆಲವೊಮ್ಮೆ ಅಸಿಡಿಟಿ ಆದಾಗ ಸ್ವಲ್ಪ ತಲೆ ಜೋಲಿ ಹೋದಂಗ ಆಗ್ತದೆ ಸರ್, ಒಂಚೂರು. ಅದು ಕೂಡ ಇವಾಗ ಕಡಿಮೆ ಆಗಿದೆ. ಪ್ರಾರಂಭದಲ್ಲಿ ಹಾಗೆ ಅನಿಸ್ತು ಸರ್. ಆಸಿಡಿಟಿ ಕೂಡ ತುಂಬಾ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್. ಇಷ್ಟೊತ್ತಿಗೆ ನಾನು ಬಹುಶಃ ನಿಮ್ಮ ಔಷಧಿ ತಗೊಳ್ಳದೆ ಇದ್ದಿದ್ರೆ ಆಸಿಡಿಟಿಗೆ ಅಂತಾನೆ ಒಂದು ಕನಿಷ್ಠ 3-4 ಮಾತ್ರೆ ತಗೊಳ್ತಾ ಇದ್ದೆ. ನಿಮ್ಮ ಔಷಧಿ ತಗೊಳ್ತಾ ಇರೋದನ್ನ ಕೇವಲ ಒಂದು ಮಾತ್ರೆ ನೀವು ನಿಮ್ ಸಜೆಷನ್ ಮೇಲೆ ತಗೊಂಡಿದ್ದೀನಿ ಸರ್. ಮತ್ತೆ ನಾನು ಯಾವುದೇ ಮಾತ್ರೆಗಳನ್ನು ತಗೊಂಡಿಲ್ಲ. ಎಲ್ಲ ಕಡಿಮೆ ಆಗಿದೆ. ನಿದ್ದೆ ಚೆನ್ನಾಗಿ
Immediately after taking the medicine, in the first week there was aggravation of gastric complaint.
ಚೆನ್ನಾಗಿ ಅನಿಸ್ತದೆ ಸರ್. ಎನರ್ಜಿ ಲೆವೆಲ್ ಚೆನ್ನಾಗಿದೆ.
Energy level is better. He's telling energy level better, sleep is better.
ಮುಖದಲ್ಲಿ ಇನ್ನು ಸ್ವಲ್ಪ ಅನಿಸ್ತಾ ಇದೆ ಸರ್, ಡಿಫ್ರೆನ್ಸ್ ಫೀಲ್ ಆಗ್ತಿದೆ. ಇನ್ ಸ್ವಲ್ಪ ಹೌದು ಸರ್, ಹೌದು. ಹಾ ಸರ್, ಹಾ ಸರ್, ಸರಿ. ಹಾ ಸರ್, ಹಾ ಸರ್, ಖಂಡಿತ ಸರ್, ಖಂಡಿತ ಸರ್. ನಾನು ಅದ್ರ ಬಗ್ಗೆನೇ ಇನ್ನಷ್ಟು ಮಾತನಾಡಬೇಕಾಗಿದೆ ಸರ್.
Next video, sir.
ಹಾ,
Can I close this?
ಖಂಡಿತ ಸರ್.
Yes, close this, sir.
ಸರ್ ಚೆನ್ನಾಗಿದ್ದೀನಿ ಸರ್.
You're telling I'm doing well.
ಸರ್ ಆತಂಕ ಭಯ ಅದೆಲ್ಲ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್. ಮತ್ತೆ
Fear,
ಎನರ್ಜೆಟಿಕ್
anxiety, everything has come down.
ಎನರ್ಜೆಟಿಕ್ ಆಗಿರ್ತೀನಿ ಸರ್.
Now I'm feeling, now I'm energetic.
ಸುಸ್ತು ಅನ್ಸಲ್ಲ ಸರ್ ಯಾವಾಗೂ. ಆಮೇಲೆ ಹಿಂದೆ ಎಲ್ಲ ವೀಕ್ಲಿ ಒಂದು 3-4 ಮಾತನಾದ್ರೂ ತಗೊಳ್ತಿದ್ದೆ ನಾನು ಅಸಿಡಿಟಿಗೆ.
Nowadays he's not feeling tiredness.
ನಿಮ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್
Earlier you were taking in a week 3 to 4 times antacid tablet. Now in this treatment, in this 1 month or 1.5 months, you have taken hardly once. Only once you have taken.
ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ಮೇಲೆ ಕೇವಲ ಒಂದು ಮಾತ್ರೆ ಮಾತ್ರ ನಿಮ್ಮ ಸಜೆಷನ್ ಮೇಲೆ ತಗೊಂಡಿರೋದು ಸರ್. ಅದು ಬಿಟ್ಟರೆ ಯಾವುದೇ ಮಾತ್ರೆಗಳನ್ನು ತಗೊಂಡಿಲ್ಲ ಸರ್. ತುಂಬಾ ಚೆನ್ನಾಗಿ ಅನಿಸಿದೆ ಸರ್ ಓವರ್ ಆಲ್.
He's feeling overall well-being. On 27th 11/23, his SpA1C was 7, FBS was 124, and PPBS was 241. After medication, after a month, Jan 2nd 24, his FBS was 106 and PPBS was 178. Now on 13th April, his HbA1c is 6.9, FBS is 102, PP is 208. He was a pre-diabetic patient. Of course, he was not on allopathic medicine. He was not interested to take allopathic medicine. 6 months back, his sugar level was better. When I took the case, I told him to undergo test once again. In that 6 months, sugar level had peaked, had gone to the peak. So now, with homeopathic medicine, his sleep is better, anxieties are better, PS are better, gastric is better, and the sugar level now HbA1c is 6.1, FBS is 102, PP is 208. He's feeling better in overall way. This is the case. I have one more case to present. That I will present in just 5-10 minutes. I will share the screen. Yes. It's a case of varicose ulcers. Patient is 40-year-old. He's a coolie by profession. He's in Bangalore. His presenting complaints were engorgement of the veins in both lower limbs since 10 years. Last year, he has underwent perforation surgery. Still, he's having veins are very prominent. Still, he's not better even after surgery. There is discharge of blood from the swollen veins from the ulcer region. He also gets recurrent mouth ulcers since 12 years on and off. Recurrent nose block. There is engorgement of the veins and pain in both lower limbs since 10 years. Which is pain is more in the evening, better in the morning. There is bleeding from the veins, varicose ulcers. In 2013, there was a procedure was done. Okay, Trundlenberg procedure, GSV stripping perforation ligation, left side perforation ligation was done. Still, he is not better. Recurrent mouth ulcers since 12 years. Location tongue, inner side of the cheek, eating spicy food. Recurrent nose block. Sometimes there is running nose. In childhood, he had chicken pox. Later, after a few years, he developed convulsions. He took some treatment which he did not open it properly. The patient is uneducated. He had not maintained any documents properly. He is telling patient the father died due to MI at the age of 45 years. Mother died due to unknown reason at the age of 50 years. Siblings are apparently healthy. He is a mixed dietarian. His appetite is good. Thirst 4 liters per day. These are nothing specific. Sleep is disturbed. Profuse perspiration, more in the scalp, head. Habits. He drinks coffee more. He's towards chilling. The observation in his case was so I would like to show the yes. This is the varicose ulcer. All of you are able to see, I think. Okay. And a few years back, he had an injury, truck accident. He had injury of the right. There was a fracture, open surgery was done. This is nothing to do with his varicose veins, but history of injury. When he was around something around 20 or 21. This is the face of the patient. I hope doctors are able to observe the patient, how he is sitting, his eyebrows, the way he seeing. Here the way he is sitting straight, slightly bending forward, elbows at the edge of the table. Your body language also tells many things about the patient. This is the case of varicose, vein. And this is the follow-up after a month of treatment, after 1.5 months of treatment. Now, earlier you were seeing an ulcer, the center of this lesion, there was bleeding. Now it has got healed in this 1.5 months. Now, if you observe very closely, even the veins which are prominent, the prominent of veins also have reduced in the prominence. And the patient is smiling. This is he's telling that earlier there was bleeding and some pus was oozing. He's telling there is no much, after 1.5 month treatment, there is no much difference in swelling of the veins, engorgement of veins, but the injury is healed. Injury is better. The ulcer is better. And this is the last follow-up, 1.5 months back. Sorry. Now, the ulcer is completely healed now. It has become dry. This is the patient in the follow-up. Now he's telling what happened. He's smiling. He's telling after taking medicine in these 3 months, I'm feeling better. He's telling the ulcer has got dried up.
The voice cannot be heard.
He's telling the engorgement of the veins has come down.
So you have to, I think that nobody can hear what he's saying. But you have to, before doing that, you have to stop share and on the
Yes, sir.
audio on.
So now, am I audible, sir, now?
Yeah, you are here. You can, we can hear you, but the audio, video is not.
You are audible, but the audio is not.
Not audible.
Videos were not audible. So at least what you could see, sir, in the I show the video, I show the pics.
Okay.
Just I want audience to. There was some technical glitch. I'm sorry for that. Actually, I had typed all these cases in the MS Word format. I could not make it convert into PPT due to the shortage of time. I would like to. I want our audience to interact with me. What was your observation in this varicose veins? In both the cases, before and after, were there any change in the, along with the reduction in the complaint? What our doctors observed, either by charting.
All are muted, sir. Only you are the one person who can talk.
Yes, sir. Yes.
So yeah, otherwise they can, in the chat box,
Yes,
they can put it.
Yes, now we can go
Right.
for discussion. Dr. Beatrice raised the hands. She is from Germany. So let us begin the discussion. Yes, doctor, but you can begin the session.
Yes, thank you very much for that very, very interesting presentation. You can hear me?
Yes,
Yes?
yes, madam. Yes, madam.
Yes. So as I'm from Germany, I don't understand any of your language the patients are talking. The observing part was interesting for me. So until now, you did not tell us the secret of the remedies.
Yes.
You see, we see the good result, we see the smiles, but we did not hear the remedies.
Yes. In the
Yes.
first case, in the first patient, madam, I had mentioned observation. The first case was taken through WhatsApp video call from distant place. He's staying 500 kilometers away from my place. When I observed the first patient, he had made all the points. He said, "Namaste, sir." He wished me. And
Yes. I saw. So for my part, okay, you did not tell the remedy until now. I was
I took the
thinking
rubric. For the first patient, I took the rubric conscientious about refills. Was very observant. I took the observant. Was frowning, and he was anticipatory anxiety, fear of dogs. Was thermally
Yes.
all
Yes,
these things. I had given the remedy like a podium.
Yes, I was saying the same. Yes. So what the case was interesting because you could show the physical complaints like gastric problems, sleeping problem, many things. And the way he was very polite and very correct. And at the end, you saw on the right side that fibroma, which is also heading for lycopodium because it's right-sided. And he, as a teacher, was feeling very, very well. And here in Germany, I don't know how it's in India, we say lycopodium is often a very good remedy for teachers.
Yes.
So, yes. And as a child, not feeling so much respected because they did not have so much money in their family, all these things happening. And you clearly could show that he was feeling better afterwards. He was smiling. He was more, like a bit more open. He was more, giving more energy to you. And was perhaps a bit more confident. So that was a very nice case. Thank you very much.
The second case, madam. As for a second case, also when we observe, he was sitting on the chair. He was sitting on the chair straightly, slightly tilting forward, elbows at the edge of the table. He was very anxious. I taken the rubric timidity, and he was frowning. That person has studied only 4th or 5th standard. He has not studied. He's a coolie. He was frowning. He was very observed. Though I studied 4th or 5th standard, when I was writing the case sheet, he was observing what I'm writing. He was observant. And all the other symptoms, I took for totality. I prescribed him. For him also, I prescribed, and he was thinking and answering. He was answering slowly. He was a little bit dull. All these things I took for totality.
Yes.
Even the varicose ulcers. For him also, I gave the remedy lycopodium. Totality.
Also lycopodium. And one question: was the ulcer on the right side of the leg? I think it was the right leg.
Ulcer on the left side of the leg. Ulcer
was on the right.
It's a bilateral engagement of the veins, bilateral varicose veins. Ulcer on the left side of the head.
Well, on the left side.
He had history of injury around 20-25 years back to the right arm. The right arm.
Okay, but the ulcer was on the right leg or on the left leg?
What? The ulcer was on the left leg.
Okay. These things are interesting. I totally agree. That's very important to observe the patients and what you see in the face. Also, like here in Germany, we have a lot of Cardium carbonicum patients. I already gave presentation to IFPH. And very often you see that swelling around the eyes, the swelling inside, the way they behave. So thank you very much for that explanation. And the varicosis of the second patient was very strong. Really, with the ulcer, he has strong varicosis, very, very difficult for him.
Yes, he has undergone bilateral perforation surgery. Still, he is not doing well. Okay, around 10 years back, he has undergone. Still, he is not doing well. So, with homeopathy, he is quite satisfied. What I observed, whenever Hahnemann told in Aphorism 253, among the signs that in all diseases, especially such are of an acute nature, even in chronic also, inform a slight commencement of amelioration or aggravation that is not perceptible to everyone. After we give medicine, patient may tell, how are you? So I'm not able to notice much change. But when you see closely, the patient is having higher degree of comfort, calmness, freedom of mind. His face is glowing, the eyes are shining, he's smiling. That means there is corresponding inward improvement of the disease, improvement of the patient. That means the follow-up, just seeing the patient's face, much before seeing the varicose vein, much before patient opening up his mouth, just seeing the demeanor, we can assess whether our patient is doing well or not. If our patient face is dull, okay, patient is not lively, where face is dull, mathematically our prescribed remedy is wrong. So much, that means just by seeing the patient's face, or else in the follow-up, we tell the patient to call after a week. Just by hearing the patient's voice, if there is no liveliness in the voice is dull, I doubt whether my medicine has worked or not. If there is liveliness over the voice, I think my medicine is working. Even if there is a liveliness over the voice in the follow-up, in the phone call, if patient says my complaints are same, I will wait and watch. I tell them to repeat the medicine. Here, for both of the cases, for the first case, I have given lycopodium 0/3, alternate day. Water dose, alternate day, early morning, 1 spoon. Lycopodium 0/3, water dose. In the second case, I have given lycopodium 200, water dose, alternate day. For the second case, I have given 200 alternate day, early morning, 1 cup of water. The deviated dose.
For how many days? For how many days, doctor?
Sir, I am giving for both of them medicine since 3 months.
That means you repeat the medicine for 3 months.
Yes, sir. I repeat the medicine. For the first case, I repeated the medicine for 2 months. Meanwhile, the water dose was over. For 15 days, I was waiting and watching. Once the patient started doing well, the alternate day medicine, for the first case, I made once in 5 days. 0/3 water dose. They have to shake 10 times like this. They have to take 1 cup of water once in 5 days.
What about
For
the
this
200 potency?
200 potency alternate days.
And
Now
that
I made
will-
it,
that
now
will
I told
be-
him to make once in 3 days.
that for how many days?
Sorry, both of them are taking medicine since 3 months.
Okay.
Since 3 months. Earlier, sir, earlier, 10 years before when I started my practice, I was giving single dose, waiting and watching.
Usually we say that when the medicine start working and when you are getting the improvement, you should stop the medicine and you just continue with the Saclac or placebo. That's
Yes,
what.
sir. Sir, I applied the same analogy, sir. When patients were doing well, I told them to take TL. Again, after 3 to 4 days, they called me, told. So when I'm taking water dose, I'm feeling better. Hanuman, I told him aphorism 248.
Whether you change the water every day or you continue with the same water for some more days.
So what I'm telling, sir, I will send 2 pills. I tell them to take 250 ml of water, Bisleri bottle or Kinley bottle. They have to put the 2 pills. One dissolve, they should give 10 strokes. They should take early morning 1 cap, once in 2 days or once in 3 days, or sometimes daily as per my advice. Once the water is about to get over, I tell them to add a few more water. And if you use the Bisleri bottle or Kinley bottle, the water will not get spoiled for nearly for 1.5 months, 2 months. What I observed. If they take the house, the household water, it will get spoiled easily. Since I cannot courier the medicine, liquid medicine, courier, it is difficult. I'm telling them to use directly. I'm not using the alcohol to preserve as a preservative. It is somehow it is working out for me, sir.
Okay.
Because we are not, while couriering the medicine, we are not able to send the liquid medicine. We have to do proper packing, which was not possible because of time constraint. Actually, Hanuman tells to give the water dose in the glass bottle, but still, unfortunately, we are giving in the Bisleri bottle, which was quite easy to dispense because water bottle is available everywhere, and even if the water bottle falls down, the glass will not break. Glass, there was some little bit risk was there, which was quite convenient. Earlier, I was giving 1 dose, waiting and watching. Patients were improving very slowly. Many patients left me. So since 5 years, started reading Organon, Pediatric Chronic Disease. Simultaneously listening to many senior homeopaths in many platforms. So now we are repeating the dose once in 2 days, once in 3 days, once in a week. Frequent repetition enhances the speed of the cure, sir.
Okay. Okay.
And whenever they are doing well, we stop the medicine after 15 days, after a month, whenever they're exposed to triggering factors, again symptoms will relax. Again, they have to repeat for few more days. It is not single dose which is going to cure the patient, sir. I had an expectation that earlier single dose will cure.
But frankly speaking, if you stick on with our philosophy, definitely you will get the same result within 3 months. Even though while using the centesimal potency, whether you are using 6 or 3 or 30 or 200 or 1 or 10 or CM. This is what many of the doctors have shown in our platform. So, but in case of this millismal potency, you can go ahead with the same method as you rightly point out here. But there are some exceptions. But what I want to suggest is that what we used to tell them is that you just put 2 to 3 pills of the millismal potency into the water and then take a dose in the morning. Then you just throw away the remains, and then you can take the similar race tomorrow, but you can even give some 2 to 3 shaking like this. Then you can again use the same, but in the very next day you can throw away the same medicine and you can repeat the same process with more tittling. So this is what I would like to add to your. Am I right, Dr. Beatrice?
Yes. There are many different ways to give the potencies.
Yes. Anyway,
One more thing I have observed, sir. One more thing I have observed. Once the medicine is over, 250 ml, and patient take more. Now the water bottle is empty almost. Sometimes I cannot. There will be regular PL to take. I cannot courier the special medicine. I tell them to add another 100 ml of water. When they shake, the nanoparticles are added to the wall of this container. When the medicine is completely dry, when they put 100 ml, they give 10 times more. Still that medicine is working. If I get 2 pills, sir, I can keep for 6 months.
Okay.
They can add water, the same bottle they can give.
Okay,
So
that's
many
all.
patients have not changed the, when water is over, they add the water, they give 10 strokes, they take the medicine. They're almost better by 90 to 90% almost. If
Yes.
you could get 2 or 3 pills with water dose, we can almost cure the patient, sir.
Definitely. Dr. Rampresh, sir, you can speak.
Thank you, Ganeshji. Congratulations, Dr. SIVASHANKAR A.
Thank you, sir.
Sir, very nice, excellent session. Single remedy use. Only single remedy use and distilled water, bottle, succession. The homeopathic medicine, dynamic and nanoparticles are very beautiful presentation. Varicose vein cure the lycopodium medicine. Lycopodium is a very deep acting remedy. Varicose vein, cause of varicose vein, patient ego, lycopodium, patient ego. So ego, varicose vein, ego, cause of ego. And second, जो presentation था, very nice presentation.
Yes, sir.
Thank you very much.
One thing I would like to share, sir. So we saw many patients who are cured by lycopodium on the basis of totality in our OPD. And so I have made a list of the patients who are cured by lycopodium, nearly 100 patients. All of them are not alike. There are third standard, they have not reached still their lycopodium. Somebody is lecturer, somebody intellectual still lycopodium. We have lycopodiums who do not have hairs. They are also lycopodium. We have full hairs, still they are lycopodium. We have lycopodiums who are dictatorial, we have lycopodiums who are tearful. There are many shades of lycopodium.
Yes, doctor. We can continue the session in some other days also. And now I invite Dr. Guruviran to have a chat with your friend, Dr. SIVASHANKAR, as well as you can say the word of thanks to the session also.
Yes, sir. Thank you very much. It was a wonderful session by Dr. SIVASHANKAR. As I know him very well since my BHMS days, he used to work hard and used to make presentations very well. So I wish him best of luck from the today's session, and we would also expect many more sessions from him like this. Very good observations, clinical findings on basis of MATERIA, MEDICA, REPERTORY, and ORGANON. So I would wish him all the best to the future presentations. And thank you for the IFPH for giving him this platform. Thank you one and all. Thank you very much.
And Dr. Maria Seva, she is from Bolivia, one of the coordinator.
Hello, everyone. Thank you very much, Dr. Ganesh. Thanks, Dr. SIVASHANKAR. It was a great session because we can rescue a lot of important concepts for the philosophy. The most important thing in homeopathy is to solve all the totality, to use the minimal doses, and to dominate the use of the primary action and the secondary action. So you show us a great cases. So congratulations and keep going. And thanks to IFPH team for these great conferences. Thank you, Dr. Ganesh.
Okay, thank you, Dr. Maria. And tomorrow also we will have a session from Dr. Siddharth Subhash, MD Homeopathy and PG Scholar. He is the HOD Department of Repertory, Ahmedabad Homeopathic Medical College, Gujarat. And the doctor will be talking about the repertorial approach in pediatric cases. That will also be a very good session. We hope all of you will be joining us tomorrow at the same time. With that, we come to the end of the session. It's over to Dr. P. Shaila to moderate the session. Thank you all for joining the session. Thank you.
Thank you. Thank you.
Thank you, Dr.